Hi. So a lot of people, when they're stressed and they don't know what to do, how to solve it, and how to just like cope up with it, they tend to use some unhealthy coping mechanisms. And one of the very, I would say dangerous coping mechanism is self-harm. I see a lot of patients who use this, you know, take help of self-harm, and I see a lot of teenagers, especially when they come and they say that, yes, I hurt myself. A lot of times they tell this to you by themselves, or you get to know this from their parents, right? But yes, adults also do it, and they would not tell you in the beginning, but eventually they tell you that they have used or they are still using self harm as a coping mechanism. But it's also very challenging because they see it as working. They will come and they tell you that, you know what, yes, I use self harm as a coping mechanism and I'm not gonna stop it because why would I? It's working for me. Like, it's very relieving. Like when they cut themselves anywhere with compass or any knife or anything, the blood that they see or the pain that they feel is something that they enjoy. A lot of times patients come and tell me that I am not able to feel any emotion. So when I hurt myself, when I cut myself on wrist or on thighs so that parents don't see it, I feel relieved. I feel some emotion that okay, I'm able to feel something. And that pain which I feel when I cut myself, the pain which comes afterwards, it's something bearable than the pain that I'm feeling emotionally. Like it, that pain is able to distract me from the discomfort or that emotion that I don't want to face. So it is actually something that has been reinforced. Like they feel that they feel that this is working, and this actually becomes one of the reinforcer in their life, so that they think nothing would work. This is the only solution that they have now. So it's actually it does for us also becomes very challenging to work with them. But yes, there is a solution, and I would suggest that if you, any classmate of yours or if any friend of yours, you see some marks or something unusual on any part of their body, or if they come and tell you that, I've been doing this. So I would suggest that you do not waste your time, because I'll tell you what happens. Most of the times, when patients are doing that, the intention is not to like die. The intention is not to kill themselves, but we don't know when that sharp object will hit you at the wrong vein, and it might lead you to some severe consequences, right? And you don't want that for anybody around you, for any near dear ones, or like any near or dear ones of yours. So I would suggest that you take action there and then, even if it's something very slight or very small. Like just a lot of patients, they do not do it with any sharp object, but rather they do it with their nails. Like they scratch themselves with the nails. Even if that is there, you need to tell this to an adult, be teacher, be, or maybe or your own parent. You tell them that, she's my friend, and I would like you to talk to her parents, his parents, in a manner where they don't scold her or they don't blame her, they don't attack her. But yeah, this is happening and we should do something about it. So that's there.